Good morning. As we are well into Domestic Violence Awareness Month, and you'll see members of the Bexar County Sheriff's Office and other stakeholders up top wearing the color purple in observance of Domestic Violence Awareness Month. The purpose of Domestic Violence Awareness Month, obviously, is not just to raise awareness of a crime that we already know is all too horrible of a scourge on our country and on our state, and certainly in Bexar County. I think every single one of us knows all too well that the crime exists and that it continues to be an issue. What Domestic Violence Awareness Month also gives us the opportunity to do is to celebrate the strides, the programs, the successes for law enforcement that we've made and that of our stakeholders as well, because every one of the programs created and success stories and positive statistics that we're able to give is a success story for victims in general. I am proud to come up today and not necessarily announce a new program, because this program that we're talking about today from the Sheriff's Office and other stakeholders is a program that many of you may have already heard of, but certainly to celebrate the first year of success, to give you some of the statistics that we see behind it. I want to highlight today the law enforcement navigation line, threat assessment line that the Sheriff's Office is proud to have worked with our fellow stakeholders here that you'll hear from in just a few. This navigation line that allows our first responders out in the field, deputies from the Bexar County Sheriff's Office out in the field, either receiving a call for service to deal with a domestic violence issue or on self-initiated activity while out on patrol, may come into dealing with a victim of domestic violence. This navigation line gives those deputies an opportunity to make a phone call to the line, talk to an operator there that is able to, once the deputy conveys the situation that's present out in the field, those between that worker manning the line and the deputy themselves, they're able to come up with a risk assessment level for that victim. Low, medium, or high, and they're able to then take appropriate actions with that victim to, in some cases, reason with them and let them know that, look, we believe that you are in grave danger and you just cannot stay in this situation. We've got to get you out now, or else you're going to become a heartbreaking statistic that we don't want it to get to that point. And so we've got to get you, your children, your pets, everybody that you know and love and hold dear out of this situation, and law enforcement and our fellow stakeholders are here to help you do that. If that's if it's a high risk assessment. If in the assessment it's found to be a low risk assessment situation, the deputy can do one of several things. They can simply give resource information to that victim should the situation change and need to be upgraded. They certainly will give that victim or potential victim some resource information available to them to help get themselves out of that situation later. They can remind them that we're here should the situation change once we leave and it becomes elevated. Give us a call back and we will certainly come back out. Or from the scene, the deputy actually has the ability, the latitude, to the discretion to upgrade. In other words, if the person on the other end of the line manning the tip line, the hotline, makes a certain judgment call on risk level, that deputy can say, no, based upon what I'm seeing around me, based upon my own knowledge and experience, my training as a first responder, I feel like it's a bit more severe than that. They can certainly upgrade that based upon their knowledge and understanding of the situation at hand. And they're able to, again, override that judgment call made by the person on the other end of the line and make them move to get that victim the help that they need. Este día nosotros estamos dando información tocante un programa que nosotros tenemos en el Departamento del Sheriff del Condado de Bexar con otros socios que están aquí ahorita. Ellos van a hablar con ustedes tocante una línea que nosotros tenemos disponible para nuestros oficiales, que ellos, si están en su trabajo y reciben una llamada por servicio y están con una víctima o posiblemente una víctima de violencia doméstica, los oficiales pueden llamar a esta línea, pueden hablar con una persona que les va a ayudar a averiguar qué tanto riesgo está esta víctima y cómo darles la información, cómo ayudarles, cómo será la situación mejor para ayudar a esta víctima para salirse de esta situación. Nuestros oficiales pueden tomar la información de la persona que contesta la llamada, pero ellos también, los oficiales ahí en la llamada, ellos también pueden cambiar el nivel de riesgo de esa víctima para poder averiguar qué son las etapas mejores para tomar con esta víctima para ayudarles a salirse de esa situación. Now that I've introduced the program and kind of given you the 30,000 foot view of what it is from the sheriff's office, a little later we can certainly talk about some of the numbers of calls for service that we've had. It's been almost approaching 1,300 in our first year, but we know that so much work is left to be done. So I would like to bring up Marta Pelaez from the Battered Women's and Children's Shelter and Family Violence Protection Services. You all, Prevention Services, my apologies. You all know that she is a steadfast champion for victims of domestic violence and potential victims of domestic violence. Certainly, we're proud to call her a friend and a partner of the Bexar County Sheriff's Office. So let me bring up Marta right now. Come on up, man.
Thank you. Thank you, Chair. Thank you very much. Good morning. While we continue to be unwavering in our efforts to bring down the number of fatalities in our community, let's not forget that fatalities are the end of the cycle of domestic violence, sadly enough, in the case of a victim. Domestic violence begins in very subtle ways. Something horrific has happened throughout the life of that victim. So we will continue to bring that information and many more, unwavering in our effort to educate the community, to let people know what a perpetrator is like, to let people know what domestic violence is, what the clinical definition of domestic violence is: emotional, psychological, verbal, physical, financial, sexual elements, where one of those constitute domestic violence, and even one of those should not be present in your relationship. Anyone who claims to love you should demonstrate true love, not through controlling and aggressive means. Power and control, leaving the victim in fear, is not equivalent to love. So with me this morning, these individuals here represent the jewel that our community is by collaborating. Collaboration is the key element. So we have the UT Health System, we have the Sheriff's Department, we have the city, and we have Patricia Castillo working steadfastly with the victims. I can speak in Spanish and I can translate all of this, but I rather prefer to give the mic to Dr. Sally Taylor, who will tell what the collaboration is and what is the action of UT Health System in domestic violence. Dr. Taylor.
Good morning. Thank you, Marta. Thank you, Sheriff. I'm Dr. Sally Taylor, the Chief of Behavioral Medicine for University Health. And on behalf of University Health, I thank you for the opportunity to talk about this very important issue. As a Level 1 trauma center, treating the effects of trauma is an important part of our mission. And it's not just the physical effects, but it's also the mental and emotional effects. As a physician and a psychiatrist, this work is important to avoid and prevent downstream effects on mental health for adults and their children. When the Collaborative Commission on Domestic Violence was formed to address the high murder rate of women by intimate partners in Bexar County, the Healthcare Committee, which is actually co-chaired by George Hernandez, the President and CEO of University Health, and Jalynn Jamison, the President and CEO of the Center for Healthcare Services, which is our local mental health authority, they defined and identified the need for this domestic violence navigation hotline to help law enforcement officers connect victims to resources. So in mid-2021, we were very honored to provide the funding for this line, and through a partnership with the Southwest Texas Regional Advisory Council, the Bexar County Sheriff's Office, and the City of San Antonio's Metropolitan Health Department, the referral line went live through Strax MedCom, and you're going to hear in a moment more about MedCom. We piloted it with the Bexar County Sheriff's Office, and as Sheriff Salazar said, when officers respond to a domestic violence call, they are walked through a risk assessment which defines the level of risk really for future death is what we're looking at. And so at that point, they can connect victims with resources. They can connect them with advocates through the Metropolitan Health Department. They can connect them with case managers in the Bexar County Sheriff's Office. And if that risk is high, that connection happens immediately. MedCom helps with that. And the other thing that we have done is we fund the family violence prevention services that Marta spoke of, specifically the Battered Women and Children's Shelter, because you never want to assign a risk level and then not have the resource available for the victim. And so this funding allowed us to expand and maintain the capacity at the shelter for immediate referral. We thank the partners. I think this is what Bexar County does best. When we see a problem and we come together and we collaborate as partners, we can solve problems together and we implement the solutions. So University Health, again, is very, very proud to be part of this collaboration. It's now my honor to introduce Dudley Waite, who's the Chief Operations Officer for STRAC, the Southwest Texas Regional Advisory Council, and he's going to give you more on the data and the calls that come into MedCom. Thank you.